Welcome to Vet NeuroJar, your daily dose of veterinary neurology insights. Today, we're exploring a real-world challenge, Encephalitozoon cuniculi, a microsporidian parasite affecting rabbits. We'll dissect a recent case report from Romania, published in Pathogens Journal, that highlights the complexities of diagnosing and managing this tricky infection. This isn't just about one sick bunny. Encephalitozoon cuniculi, or E. cuniculi, can be a real puzzle for pet owners and veterinarians alike. Think of it as a microscopic fungus that primarily targets domestic rabbits, though it can pop up in other species, including birds and even humans. That's right, it's considered a zoonosis, meaning it can jump from animals to people. But how worried should we be about this potential human connection?
Luckily, human infections are rare and usually only a concern for individuals with weakened immune systems, children, the elderly, or organ transplant recipients. When it does affect humans, it often shows up as digestive or neurological issues. Now, back to our primary patient, the rabbit. The case report details a 5-year-old neutered male rabbit who presented to a clinic in Romania with a concerning set of symptoms. Lethargy, reduced appetite, neurologic signs, and an inability to maintain balance were all red flags. Can you picture how distressing that would be for both the rabbit and its owner?
On examination, this rabbit was hypothermic, had a distinct head tilt, ataxia, and a distended abdomen. It's like a checklist of worrying signs. But what could be causing all of this?
The veterinarians suspected encephalotozoonosis, among other possibilities. During the 13-day hospitalization, the rabbit underwent a battery of tests. Radiographs revealed a distended stomach and intestines, along with some mild lung changes. Fecal examination came back negative. Blood work, however, showed signs of dehydration and potential liver and kidney issues. The roller coaster continues. Due to financial constraints, serological testing for E. cuniculi was performed rather late, on day 10 of hospitalization. An ELISA test came back positive, and further testing revealed elevated levels of both IgM and IgG antibodies. What does that mean?
Well, a high IgM level can indicate an early infection, while high IgG suggests a chronic or latent infection. When both are elevated, it could point to an active infection, whether it's new, reactivated, or a reinfection. In this case, it suggested the rabbit was actively fighting the parasite, but didn't tell us when the infection first occurred. But the diagnostic journey didn't end there. The team also performed molecular testing using real-time PCR to detect E. cuniculi DNA in various samples. And the results?
The parasite's DNA was found in the urine, feces, brain, kidney, and even the urinary bladder. Interestingly, the urinary bladder had never been previously reported to have been tested. However, the eye lens, liver, lungs, and heart were negative. These findings seem to confirm the active presence of E. cuniculi, particularly targeting the nervous system and kidneys. Necropsy revealed subcapsular petechiae on the kidneys. Histological analysis showed inflammatory lesions in the brain and kidneys, further supporting the diagnosis of encephalotozoonosis. Now let's talk treatment. In this particular case, fenbendazole, the typical antiparasitic medication for E. cuniculi, was not administered because of concerns about potential liver damage. Instead, the rabbit received supportive care, including intravenous fluids, pain medication, and assisted feeding. The animal's neurological symptoms worsened and euthanasia was elected. This case highlights a critical point. E. cuniculi infections can be incredibly challenging to treat, especially in acute cases. Treatment focuses on reducing inflammation, managing neurological signs, and providing supportive care. Sometimes, despite our best efforts, the outcome remains unfavorable. So, if treatment is difficult, what can we do?
Prevention becomes paramount. For pet rabbits, especially those housed indoors, the risk of horizontal transmission, meaning spread from other animals, may be relatively low. However, vertical transmission from mother to offspring is a concern. Regular serological testing, even in isolated rabbits, is a good idea. Maintaining a stable, stress-free environment and practicing thorough disinfection can also help minimize the risk of infection. What did the authors learn?
The study confirmed E. cuniculi infection through a combination of serological and molecular tests, along with clinical signs and histopathological findings. The positive result from a urinary bladder sample opens a new avenue for future diagnostic explorations. This case underscores the importance of comprehensive diagnostics when dealing with neurological or renal signs in rabbits. Encephalozoonosis should always be on the radar, and early detection can improve the chances of successful management. And that wraps up our exploration of this fascinating case report. Remember, Encephalitozoon cuniculi is a complex and challenging disease, but with vigilance, proper diagnostics, and a focus on prevention, we can help protect our Legomorph friends. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.